Hello, and welcome to today's video about 7 stroke symptoms 1 month before it happens. You've heard of a stroke, but have you ever wondered what happens before one strikes? Could your body be quietly giving you warning signs months in advance? If you notice any of the signs I'm about to reveal in this video, it's essential to seek medical attention immediately. These subtle yet powerful warnings could signal that a stroke is looming, and they can appear as early as 1 month before. Ignoring them can lead to a delayed diagnosis, which significantly raises the risk of irreversible brain damage. It's important to realize that strokes don't discriminate. Regardless of age, gender, or health status, strokes can happen to anyone. In fact, cardiovascular diseases are rising across all populations, including younger people. Strokes remain the leading cause of death in the U.S., with over 795,000 people affected annually, and tragically, almost 159,000 lose their lives to it each year. Stay with me as we uncover 7 warning signs that could surface a month before a stroke and learn how you can act early to protect yourself from becoming part of these alarming statistics. These early indicators are often subtle and easily missed, but recognizing them could make all the difference. Regardless of your health or age, vigilance is key. Sharing this knowledge with your loved ones might even save a life. I'll also walk you through the differences between ischemic and hemorrhagic strokes, what a brain aneurysm is, and why recognizing a transient. Ischemic attack, TIA, is crucial for preventing a major stroke. If you have a family history of brain aneurysms, especially in first-degree relatives, it's vital to consult a neurologist for early screening, even if you feel fine. Now, let's explore the 7 signs to watch for a month before a stroke hits. If any of these happen, don't hesitate. Act fast and get medical help right away. For a deeper understanding of stroke prevention, you may want to explore further resources such as the American Heart Association or recent research on stroke risk factors published in journals like Stroke and The Lancet Neurology. These insights can help you stay informed and prepared. If you experience any of these signs that I'm going to tell you about in this video, you should seek medical attention immediately because they could be signs that a stroke is about to happen. Symptom 1. Persistently elevated blood pressure. Persistently high blood pressure is one of the clearest indicators of stroke risk. When left uncontrolled, hypertension can quietly increase the likelihood of a stroke. Blood pressure measures the force of blood pushing against the walls of your arteries. When this pressure remains elevated over time, it causes wear and tear on the arteries, leading to narrowing, weakening, or even rupture. This, in turn, can trigger either a hemorrhagic stroke, where a blood vessel in the brain bursts, or an ischemic stroke, caused by restricted blood flow to the brain. The danger here lies in its subtlety. Many individuals may not realize the damage happening inside their bodies until it's too late. Managing hypertension through lifestyle changes and prescribed medication is critical to reducing stroke risk, regardless of age or overall health. Symptom 2. Excessive fatigue. Do you often feel exhausted for no clear reason? Unexplained and extreme fatigue can also be a warning sign of an impending stroke. While fatigue can have many causes, persistent tiredness that doesn't correlate with physical exertion or lack of sleep could point to reduced blood flow to the brain. As the brain receives less oxygen due to restricted arteries, the body may struggle to function properly, leaving you feeling drained. In some cases, extreme fatigue may even precede a transient ischemic attack, TIA, often called a mini-stroke. TIAs are temporary disruptions in blood flow to the brain that can vanish within 24 hours but serve as urgent warnings of an impending stroke. If you're experiencing this unusual level of tiredness, don't dismiss it. Seek medical attention promptly. Symptom 3. Vision problems. Sudden changes in vision, such as blurry sight or double vision, can be an early sign of circulatory issues in the brain. It may feel like your eyes are acting up, but in reality, this could be your body's way of alerting you to a stroke on the horizon. Vision problems can occur when an artery that supplies blood to the eyes becomes blocked or restricted, often a precursor to an ischemic stroke. While there are many causes for vision problems, never ignore sudden or unexplained changes, especially if they are accompanied by other symptoms. Acting quickly in these cases can prevent more severe damage. Symptom 4. Sudden and severe headache. A sudden, intense headache, often described as the worst of someone's life, can precede a stroke. In ischemic strokes, headaches are caused by the blockage of blood flow in the brain. These headaches appear abruptly and with significant force. Hemorrhagic strokes, caused by bleeding within the brain, result in even more severe pain due to increased pressure in the skull. In many cases, witnesses report stroke victims clutching their heads in pain before losing consciousness. If you ever experience an unusually severe headache, don't ignore it. Seek immediate medical care, as it could be a sign of something far more serious, like a stroke or even an aneurysm. Symptom 5. Numbness or weakness in extremities. If you feel sudden numbness or weakness in your arms, legs, or face, particularly on one side of the body, it could signal an impending stroke. This often occurs during a TIA, where blood flow is temporarily reduced. The symptoms may last for only a few minutes or hours, but that doesn't mean the danger has passed. In fact, these episodes are your body's way of warning you that a full stroke may be near. Even if the symptoms resolve on their own, immediate medical attention is crucial. Waiting too long can result in permanent damage when a full stroke occurs. Symptom 6. Speech problems. Trouble speaking, whether it's slurred speech or difficulty forming sentences, can be another red flag. Stroke-related speech problems, known as aphasia, can range from mild difficulty finding words to complete loss of speech. This is often one of the most noticeable signs of a stroke in progress. If you or someone around you suddenly can't speak or understand language, call for medical help immediately. Symptom 7. Neurological issues. In the days or weeks leading up to a stroke, you might notice more subtle neurological symptoms such as memory issues, loss of balance, nausea, or even vomiting. These symptoms, while less obvious than others, should still be taken seriously. Various conditions, including migraines, anxiety, and even infections, can cause similar issues, making diagnosis more complex. However, if you experience any of these alongside other stroke symptoms, don't hesitate to get evaluated by a healthcare professional. Understanding the types of strokes, ischemic and hemorrhagic, helps in recognizing the differences in symptoms and risks. Ischemic strokes occur when a blockage restricts blood flow to the brain, while hemorrhagic strokes involve a blood vessel rupture, causing bleeding in the brain. Both types are medical emergencies, but they present in different ways, and the treatment for each varies significantly. For ischemic strokes, common causes include blood clots or plaque buildup in the arteries, which restrict the brain's access to oxygen and nutrients. Hemorrhagic strokes, on the other hand, often result from a cerebral aneurysm, a weakened blood vessel that bursts, spilling blood into the brain. Cerebral aneurysms are particularly dangerous because they can exist silently for years, only becoming symptomatic when rupture is imminent. The good news is that with modern screening methods, such as CT angiography or MRI, doctors can detect aneurysms before they rupture. If a family history of brain aneurysms exists, it's crucial to undergo regular screenings, even without symptoms. How to prevent a stroke. Taking steps to prevent a stroke is just as important as recognizing the warning signs. Controlling high blood pressure, managing diabetes, maintaining a healthy weight, and exercising regularly all contribute to reducing stroke risk. Additionally, avoiding smoking, limiting alcohol intake, and managing cholesterol levels play a crucial role in stroke prevention. If you experience any of these symptoms, take action and consult a healthcare provider as soon as possible. Remember, early intervention could be the key to preventing a life-threatening stroke. Now that we've covered these crucial warning signs, it's clear how vital it is to recognize them early. Spotting symptoms like sudden fatigue, vision changes, or severe headaches can help you take immediate action and potentially avoid a life-threatening stroke. Sharing this knowledge could protect your loved ones as well, since strokes don't care about age or health status. Staying informed about the differences between ischemic and hemorrhagic strokes and the importance of brain aneurysm screening further empowers you to safeguard your health. If you found this information valuable, make sure to pass it on to those you care about. And don't forget to subscribe for more important health insights. Plus, hit the notification bell to stay updated on our latest videos. Have you noticed any of these signs in yourself or someone else? Let us know in the comments, and thanks for watching. We'll see you in the next video.